Hello and welcome to today's episode of Chlamydia Explained with your host Dr. Bret Palmer. So have a little bit about me. I'm actually a sexual health doctor during the daytime, and of an evening I try to explain what a particular sexual infection is all about, so you can have a bit of useful information. So tonight's episode is about Chlamydia trachomatis. So what is chlamydia? Well, chlamydia is caused by a little bacterium called Chlamydia trachomatis. For the rest of the show, we'll just be calling it chlamydia, and it lives in the genital tract of men and women. So in women, it's in the vagina and around the cervix, and in men, it's in the urethra. It's usually an asymptomatic infection. What that means is you don't have any symptoms. The vast majority of people who have chlamydia, like with most sexually transmitted infections, they don't have any symptoms whatsoever. So how many people are infected? Well, around the world, about 60 million people. In America, it's about 1.5 to 1.6 million people. In the UK, it's 200,000. So it's quite a lot of people who actually have it. In terms of the symptoms, as I said, if you're sexually active and you've had sex with someone who is not a virgin, and you're not a virgin yourself, you're going to at risk of picking up chlamydia. Now, chlamydia is more common in those under 25, but even if you're in your late 30s or in your 50s, you can still get chlamydia if you're having a new partner and you're not getting tested before relationships, or you're not getting regularly tested. You could be a carrier, so you need to get yourself tested. There is a small proportion of individuals that do have symptoms, and for women it could be a little bit of discharge. More aggressive cases can lead to things like pelvic inflammatory disease, which the easiest way to find out if you've got pelvic inflammatory disease is, do you have pain on sexual intercourse, especially a deep-seated pain? That's a warning sign. Also a discharge as well. Don't bother about the colour of the discharge. If your discharge has changed and is different from normal, then you should get yourself to a sexual health clinic for a checkup. For the men, you could have a little bit of discomfort when you pee, and you could also have a little bit of discharge as well. If you leave chlamydia, what could happen? Well, for women, I told you about PID, or pelvic inflammatory disease. That's when the infection goes up to the womb, and then can go across into the fallopian tubes. This can lead to greater infertility if it's just left, and as well as infecting the tubes, and that can then lead on to ectopic pregnancies, because the egg can't make its way down the full length of the tube, for reasons I'm not going to go into now. For men, the infection may start off in the penis and goes back all the way to the prostate and to the testicles, and that can lead to something called epididimal-orchitis, which is a bit of a mouthful. It basically means you've got painful balls, which is not much fun for anyone. So it's not worth waiting around to seeing if it will go away. Admittedly, a lot of infections will clear naturally between 1 and 15 months, but you won't know whether it's cleared in 1 month or whether it's going to take 2 years or so. So get yourself tested. That's the most important thing. Testing is really, really simple. For men, you just have to pee, do a urine sample in a small plastic tube. For women, you just need to take a swab and do a blind vaginal swab. If you need an examination, the doctor can also do it as well. If you do oral sex, you also need to have a swab of the throat, just of the tonsil areas at the back of the throat. In some clinics, you can do this yourself. And if you also do anal sex, you'll also need to have a swab of the rectum as well. It's a very, very simple test, doesn't hurt, and the results can come back relatively quickly. Treatment for chlamydia is also very, very easy and simple, and there's 2 good treatments around. One is one day 4 tablets in one go with a drug called Azithromycin. Another is a 7-week course of doxycycline. If it's a little bit more of a complicated infection, then you may get 2 or even 3 weeks of doxycycline. If you're wondering how to prevent it, condoms is the simplest way. Condoms aren't 100% perfect, but with good use they can be anywhere between 95 and 98% perfect, which cuts down your chances of getting an infection or passing an infection on to other people. My advice is, if you're starting a new relationship, both go and get tested, because neither of you will know whether you're carrying chlamydia, and when you go for a chlamydia test you would automatically be offered a test for gonorrhea, which is done on the same swabs, and you'll also be offered a blood test as well for HIV and syphilis. My recommendation is that you take it. That's it for me. If you have any more questions about chlamydia or anything else, please let me know, and I will see if I can make a video on that. And so if you enjoyed this video, or you liked it anyway, please like and share and subscribe, and that way you will know when the next video is coming. Thank you very much. Take care. Oh, and good sexual health.